Good afternoon. I'm Dr. Jazz Atwal. I'm the Acting Deputy Chief Provincial Public Health Officer. I'm joined today by Ms. Lanette Siragusa, the Chief Nursing Officer for Shared Health. Today, we are announcing 5 additional deaths due to COVID-19. 4 from the Winnipeg Health Region and 1 from Southern Health, Santé Sud region. I want to extend my condolences to the families, friends, and caregivers to these individuals announced today. The current 5-day COVID-19 test positivity rate is 12.4% provincially and 12.1% in Winnipeg. As of 9:30 a.m. today, 133 new cases of the virus have been identified in Manitoba. The total number of lab-confirmed cases in Manitoba is 24,385. I'd like to remind Manitobans that contact tracing calls may come from local 204 numbers, or from a 1888 number, or a 1855 phone number, because Stats Canada, the Red Cross, and automated calls are all helping us do contact tracing. Please be sure to pay particular attention to your phone calls, even if they are from different area codes. It could be us calling with important information about your health. Our numbers have started to come down, but when people don't answer their phones, that means people who have been identified as close contacts and exposed to COVID-19, who eventually could become positive and transmit the virus to others before symptom develops, are not isolating. This can keep the transmission of the virus ongoing. If we effectively identify and isolate those close contacts, that stops virus transmission because that person should have no additional contacts. I also want to remind people to go for testing if experiencing COVID-19 symptoms, no matter how mild, and self-isolate immediately. Being tested and self-isolating makes all the difference in our fight against COVID-19. 133 cases sounds like a good number. We are headed in a good direction, but we still have a long way to go. There were only 1,300 tests on Monday. We typically see lower test numbers after a holiday and earlier in the week. 133 cases and 5 deaths does not mean we can be careless with our actions. It does not mean we can take the restrictions currently in place less seriously. It does not mean we can go see friends and family outside our household or host people this Thursday to celebrate the new year. It means that our hard work is starting to pay off. It means limiting our contacts and working from home is making a difference. It means we need to keep doing what we are doing. I know it is hard, especially when we have been working so hard for a long time. We need to keep limiting our contacts to our household. We need to keep only going out for essentials and sending one person to do so. It means working from home if you're able to do so. And I encourage employers to keep working to help make that happen. Stay home when you are sick, wash your hands, cover your cough, and wear a mask. All of these actions are making a difference, the difference we are seeing now. Yes, our numbers are going down, but our test positivity rate is still high. It is still too high. And our health system is still being stretched to meet the demand. The vaccine is a significant sign of hope, but we are in the early stages of delivery. Delivery will take time, and we need to be patient. We need to focus on the fundamentals to keep you, your loved ones, your neighbors, your co-workers safe. The virus is not done with us. I urge you to keep practicing the fundamentals and staying home. I do want to wish everyone a happy and healthy New Year, but as I've said before, don't let celebrations bring risk or harm to anyone else. Let's start the new year off with continued lower numbers. Let's have a good start to 2021 because we are focusing on the fundamentals and staying home. I will now pass it over to Ms. Lanette Siragusa.
Thank you. Good afternoon, everyone. This morning, there were 338 COVID patients who were in hospital, and this includes 246 patients who actively have COVID, as well as 92 who are past their infectious stage but still requiring acute care support. As of midnight, our ICUs were at 153% of what our normal pre-COVID activity would be, our capacity. We have 110 patients in ICU. This includes 36 who either have COVID or are just recently past their infectious stage, but still very sick. 27 of our 62 ventilated patients this morning have COVID, and this includes 3 COVID patients who are no longer infectious. Last week, we announced that a pilot was underway for personal care home staff to be tested for COVID-19, so that is now well underway. What it does is it allows us to look at the Abbott PanBio device and evaluate its effectiveness and better understand how we can use that device, that rapid testing device, to deploy and use in other healthcare settings or personal care homes as well. Asymptomatic testing was already a tool that we were using in personal care homes where there were outbreaks happening and confirmed cases. This pilot project now broadens the testing for staff at 3 specific sites now, Donwood Manor and Deer Lodge Center in Winnipeg, as well as Country Meadows Personal Care Home in Nipawa. In the first week of this pilot, 314 staff were tested using this Abbott PanBio device, and the results are available within 20 minutes. To date, we've had 1 positive case confirmed, and there was another case that was also ruled invalid after it went for lab testing. Testing is expected to continue at these sites for the next 3 weeks, at which case we will evaluate the opportunity to expand beyond these 3 sites to other PCHs. I'll also give you an update on our sick time within the healthcare system, specifically within Winnipeg. There were approximately 107,000 hours lost to sick time in the most recent 2-week period, which is actually an improvement from my last report where there was nearly 6,000 more hours in the previous pay period. Compared to our 5-year average for this specific pay period, it amounts to an additional 1,400 8-hour shifts per week that have been lost to sick time. And the reasons why staff may be sick or away, we can't always say it's because of COVID. However, these high levels of sick time being used now when we really don't have influenza circulating would strongly suggest that it's tied to staff who are either tested positive for COVID or have been identified as contacts of a case and need to isolate. So we continue to take steps to make it easier for our staff to get tested, and that includes the Rotogene that is being offered at St. Boniface Hospital and Health Sciences Center. And this device allows for symptomatic healthcare workers to get tested quickly, and if they're negative, they can be cleared and returned to work. And this device, specifically the Rotogene, will give results in 4 to 6 hours. We've also set aside appointments, spaces specifically for healthcare workers and first responders at our testing sites on Pembina Highway and St. Mary's Road. And there is a dedicated testing site at the Winnipeg Fire Paramedic Services Training Academy. They are piloting rapid testing as well on symptomatic individuals using the Abbott ID Now device, which provides results in as little as 10 minutes. So there's lots of rapid testing device coming out, and we're very interested in making sure they're valid and effective tools to deploy further. Also, just wanted to report that late last week, the First Nations Inuit Health Branch requested assistance with nursing station staffing over the holiday period. And with the help of our provincial recruitment and redeployment team, we were able to identify 6 advanced care paramedics who were available to be assigned and deployed. So between December 27th and 30th, pairs of ACPs, advanced care paramedics, will be providing care in the communities of Shamattawa, Oxford House, and Wasagamak. So we would like to sincerely thank these paramedics for their time and skills to help fellow Manitobans, especially during the holiday season. And I think I'll keep it short. I know there's lots of questions and happy to answer any and all of them. And I also want to wish everybody a happy, safe, quiet New Year's. And we can open it up.
Thank you. A reminder to our reporters on the line, you will have 1 preliminary and 2 follow-up questions. Up first this afternoon from the Winnipeg Sun, Scott.
Hi, good afternoon to both of you. First question, or Scott Bill with Winnipeg Sun. First question, Dr. Atwal, you talked about people not answering the phones or the calls coming in. Are contact tracers leaving messages for people, ways to get back in touch with a contact tracer? And if not, why not?
That's a good question. My understanding is that they are leaving messages, and again, I'll have to clarify that. Again, people do have to answer that phone. They need to connect with them. Otherwise, there's a lot of telephone tag that gets involved in this process as well. So if you aren't able to connect with someone right away, that resource is taken away to be able to do some work, and then we have to kind of reconnect with an individual as well. Again, make sure that those calls are being answered. Even if it is a telemarketer, you could always hang up right away, but you want to make sure that you're able to connect with your public health individuals and workers from Manitoba to make sure that we're all partaking in our duties to limit the spread of COVID-19.
Thanks for that. Wondering as well, another question for you. Wondering, Ontario is starting to use all of their first doses just for that. They're not saving any doses. They're putting as many needles into arms as possible in terms of their vaccine. Is Manitoba prepared to do that? Are you guys looking at doing that? Does it stand with those initial doses? Will you use them all, for as many people as you have those first doses, or are you not entirely sure yet of supply chains?
Yeah, it's a great question. We planned out our vaccine rollout early on with a certain number of doses being anticipated. There was a lot of question marks in relation to how many doses are going to come in. There was numbers that were moving around almost on a daily basis, and even now those numbers do change. So what we planned for was a smaller operation to take those first steps in relation to one of the it's going to be the largest and most important vaccine program in Manitoba, with a number of logistical issues related to the vaccine itself. This vaccine that we have, the Pfizer product specifically, it entails another level of logistical issues related to cold chain that we have to worry about. So the doses we were planning on giving out, we have given out. So at the present time, I believe the last numbers were 2177. We're planning on another 1,000 this week as well at the site that it's presently at. And we're ramping that up so that next week we're looking at roughly 6,000 doses to be administered at our convention center site that opens up on the 4th. So I think everything's going to plan, and we had a process in place. We want to make sure this is a safe process. We want to make sure it's effective. We want to make sure everyone's well informed, and we are taking those steps to build that capacity. But we also we can't start at 100 miles an hour. We have to take those first few steps to kind of bridge that ability to get to those higher volumes of people to immunize.
Thanks for that. And last question. So you talked about 6,000 more doses next week. Do you have more concrete numbers now on how many more doses are coming in the first couple of weeks of January? Do you know the split of those? I know you've talked about 10,000 per week in January. Is that still on track, or are there more? Can you speak a little bit to that?
Well, our first site is the Convention Center site on the 4th. I mean, we are looking at the Keystone Center as well, and I think we have a date on that. I believe the up and running date will be the 18th on that, and we are looking for sites there afterwards. And I mean, there's work being done on this every day. There was work done on this over the last weekend as well on the holidays. So every day there's work being done on it, and we have to change the work that we do sometimes with the anticipation of what doses are coming in as well.
From CBC Radio Canada, Matthew.
Hi, my question is for Dr. Atwal. Dr. Atwal, what can you tell us about enforcement last week? Have you seen a lot of people breaking the gathering rules?
Yeah, you know, I don't actually have an update on that as of yet today. I think an update's going to be posted later on today, so that should be available online.
Okay. And would the province support and airport testing for the arrival of international travelers?
Could you just repeat that question, sorry?
Okay. Would the province support an airport testing program for the arrival of international travelers? You know what I mean?
Yeah. So, you know, you're asking about testing at the airport and international travelers. So, you know, from a public health perspective, we're looking at all the tools that we have. We're starting to operationalize more tools, and that's something that, again, isn't out of our toolbox. We are going to look at that and look at the utility of that. There's a lot of projects on the go right now in relation to testing, so we are discussing that at public health.
Thank you.
From CBC Manitoba, Bart.
Hi, Dr. Atwal. I'm going to ask you to try to answer the second question that Scott asked about Ontario. What do you think is the merit to using all doses when you get them rather than holding doses back?
You know, that's something, again, there's merit probably to looking at providing all those doses, but there's also some unintended consequences. You know, the supply chain issue is real. You know, we have a set number of doses right now. You know, I'm not involved in Ontario's immunization strategy. You know, we do meet at a provincial level with other stakeholders across the other provinces. And even today, you know, we have meetings in relation to the rollout of this vaccine. On a rate basis, our vaccination rates on a per capita basis are higher than Ontario's, I believe. That's the last number I saw as of yesterday. So we're sort of middle of the pack. We're higher than the Canadian average with the vaccine doses that we've given out already. So I'm very comfortable with the way that we're approaching this. Again, we want something that's safe. We want to make sure that we're able to operationalize it in a manner that is always consistent. We don't want any hiccups. So you know, slow and steady sometimes is a little bit better than rushing to something. This is a marathon. The vaccine program is a marathon. This isn't a 100-meter race. We're at the beginning of a marathon. So I think we all need to take that into account. And again, safety is paramount. And we want to make sure we do this right, that we are able to impact the most Manitobans in a safe and effective manner.
Thank you for that. Where will the first vaccine or Moderna vaccine shipments go?
I believe they're going to one of the warehouses in Winnipeg here for storage, and then we're looking at a plan to roll those vaccines out to the appropriate populations.
Appropriate populations. Earlier today, Dr. Lavallee from First Nations Health said that when you look at the priority groups, given the overrepresentation of First Nations patients in ICU, in hospital, that all Indigenous people, including urban Indigenous people, should be in that first priority group. Right now, you've only got adults at risk in remote First Nations in your early 2021 priority group. What do you make? I mean, look at the data, you can see the overrepresentation. What do you make of the suggestion that more Indigenous folks get the vaccine early on?
Right. So, you know, part of the whole COVID-19 risk here, you know, it's a risk to our acute care system. It's also a risk to PCHs. It's a risk to individual communities as well. It's a risk to certain populations. Our acute care system needs that security. And we can't be losing workers, as Ms. Siragusa had mentioned earlier, 107,000 hours of work, you know, in a short period of time. That's a lot of work to be lost. That impacts our ability to treat people. So a priority group is, yes, our critical care, our acute care, are those people who are working with patients with COVID. I mean, that is a priority. The PCHs have a high risk associated with them. And we've seen the risk. We talk about the deaths, right? So there are only so many doses of vaccine coming in. Again, there's logistical issues related to some of the vaccine that's coming in. So we're still working through all that and the planning thereof. And as time goes on, day by day, that vaccine eligibility changes, but it also has to take into account who we need to protect first to make sure the system is able to manage all those sick individuals or the potentially sick individuals.
From the Canadian Press, Stephanie.
Hi, Dr. Atwal. Has Manitoba detected the new UK variant of COVID-19? And if the answer is no, do you think it is likely the province will?
So at this point, I know we haven't had a UK variant found in Manitoba. Work is being done to look for that, and work has been done to look for that. So again, a number of samples have already been checked, and we're going to continue to work on that. And at this point, again, it hasn't shown up. Do I anticipate at some point it might? Again, that variant has been around since September in the UK. So you can imagine the number of individuals that have traveled across that ocean and their movement within cities or within provinces. So, Ontario has a couple of cases from my understanding, Alberta and BC. It's always possible that it is in Manitoba. Again, we just haven't seen it yet.
When you say you're looking at the samples, are you analyzing the strain from just travelers, or are you looking for it for folks with no travel history just in the community?
Yeah, it would be both. So when we do genomic sequencing, we just didn't start genomic sequencing just because of a UK variant. It's been happening all along to look at mutations within the virus, to understand what those mutations mean. That wasn't just done in Manitoba, it's been done in other provinces and right across Canada. This is in partnership, with all those partners as well, and we share information at a high level with all the other provinces as well. So again, this has been ongoing since the beginning of the pandemic. It's going to continue to happen as well.
Okay, Doctor. Manitoba has seen some progress when it comes to the fight against COVID-19. Is public health looking at loosening the gathering restrictions to allow people to possibly have 5 or a couple folks over to their homes when the public health rules are set to expire January 8th? Is this something that public health is considering, loosening the rules around gathering limits inside homes?
Yeah, we're going to look at everything on the order side. I think, and again, we need to be cognizant. We've had a few days where our numbers have reached below 200. We still have a strain on our acute care system. There's still hundreds of people in hospital. We are generating less cases, so over time that'll, reduce the number of people in hospital with COVID or recovering from COVID. But our order's still in place for another, roughly 2 weeks, right? So, as we approach that date, I think we'll have a better idea what we're going to look at advising from a public health perspective. And a lot of this is going to depend on Manitobans. Right? Are Manitobans going to do what they need to do, what they have been doing? Is that going to be ongoing for the next week to 2 weeks' time and thereafterwards as well? So again, everything is being looked at. We look at everything every day. We were talking about this on the weekend as well and over the holidays, right? So it is imperative that Manitobans continue to do what they have been doing and need to do for the next while.
From CTV Winnipeg, Turia.
Good afternoon, Taria here from CTV. I'm just wondering, if the Winnipeg Airport Authority says that few cases are coming in from travel, then does it make sense to continue to have the 14-day requirement from people from Eastern Canada to self-isolate? Is that something that public health is looking at if this rapid screening at the airport does materialize?
Yeah, a lot of these, I think we need to understand the impacts of rapid testing and what it actually means. A negative test doesn't mean you're safe. I mean, there's risk attached to that, right? So we don't do rapid testing unless it's going to impact what we do from a client perspective. A lot of these tests, you're able to trust a positive, but you can't trust a negative. right? So again, there's a lot of different tools out there. There's a lot of different point-of-care testing devices. From a public health perspective, we are utilizing a lot of these devices in Manitoba in specific situations under the guidance of public health, but we need to be careful what that test result means. You never want to provide someone false reassurance because that can cause some issues. And again, those are the things that we're thinking about and looking at and working on our testing strategy.
And, First Nations leaders have said that there's a lag in information about how the Moderna vaccine is going to be distributed. I mean, why don't we have more information at this point about where it's going?
Right. So, I mean, there is a vaccine task force, which has a number of government bodies involved with them. There is a First Nation stakeholder involvement with that task force as well. We have limited supplies of vaccine. And we have healthcare workers all across Manitoba in different jurisdictions and in First Nations communities or servicing First Nations if they're located centrally. We have to look at, those healthcare workers and make sure that they are able to access that vaccine so that they are protected, so they could stabilize that workforce. And again, we're at the early stages of vaccine. There isn't hundreds of thousands of doses of vaccine sitting around where we're just picking and choosing. We have to look at that hierarchy, understand where the risk is, protect those that have, impact on a risk perspective and also from an operations perspective, to be able to have an acute care system, to be able to have those workers and those essential jobs continue to be able to work. So again, there's a lot of work being done on this. And again, we're at the very early stages of a marathon. So we're going to continue to work on this and make sure that risk is taken into account and, provide vaccine to those most at risk and work our way backwards from that.
And is it premature at all to say that and you sort of alluded to this, but maybe you can elaborate, that we're seeing progress if, there are fewer cases, but the test positivity is quite high and the number of tests being done is quite low. So just, is it that we are seeing the restriction measures, having a positive effect, or is it partly that not that many people are getting tested right now?
Yeah, I think we saw when we put the restrictions in, our case numbers were expanding. They were going up perhaps exponentially, right? They're when you look at that graph, it was moving up rather quickly. Our hospitalizations were increasing. We saw that plateau, right? We saw that plateau after a couple of weeks. Now we're starting to see that decline, right? So, limiting those interactions between individuals, I firmly believe that's helping, but by no means are we out of the woods, right? Like, we still have a long way to go here to start off 2021 in a good manner, in a manner where we're able to look at other opportunities, perhaps, right, to be able to do to be able to get Manitobans back to some of the things that they were doing, but we can't be complacent. So I think we're heading in the right direction. Our hospital numbers are slowly coming down, but again, there's that lag time. Right? There is a lag time between case generation and when someone enters into a hospital. So again, we've had some, pretty good numbers, but they're still over 100. We like to see those numbers come down over 100 for a period of time. And then with that, the hospitalization numbers should come down quite nicely as well. So it is still imperative that Manitobans continue to, physically distance, not have others over at their home, and only just go out for those essential activities. And again, if people are sick, they should get tested. With weekends and holidays, we've always had lower numbers from a testing standpoint. So again, day by day, week by week, this is all being looked at, and we'll have a better gauge of things as time goes on.
From City News, Mike.
Hey, good afternoon, everyone. Dr. Atwal, did we halt administering the vaccine over the holidays at all to first responders and doctors? And if so, how long did we put that hold on?
Yeah, I mean, we planned for our vaccine program, so the doses that we were planning, we provided on the days that the clinic was open. We didn't have clinics planned for, let's say, the holiday days, and essentially we were providing all the vaccine that we planned for on the non-holiday days. We didn't hold back doses. So again, this week those clinics are open again, and we're going to provide all the doses that we're planning for and anticipating by Thursday. And there's going to be roughly 1,000 people this week in relation to that as well.
So did we have any first doses that could have been administered to anybody during those days when we weren't administering?
So the only doses that were given were during those immunization clinics that I'm aware of.
Right. So the long and short of my question is that if, it was important for us to get the vaccine early and the vaccine came earlier than we could have expected, isn't it important to not take any days off in the future and plan a clinic for every possible day just to make sure that we can immunize as fast as possible?
Yeah, so I kind of alluded to this earlier. We planned for clinics based on the number of doses that we're getting and expecting, right? So I think that went well. Again, we had to start off a smaller operation before we get into a larger operation. Obviously, there was some hiccups along the way there as well. So again, we have to start small and make a program bigger. So that's exactly what we're doing. So from a planning perspective, we're doing what we wanted to do and what we're desiring to do. Again, it's not about it's not a race, right? It's not about putting in that vaccine into someone's arm as fast as possible. In some parts, in some ways it is, but we also have to think about safety, right? We have to think about how this operationalizes. We have to look at medical consents, right? We have to look at how patients are flowing through a facility to make sure that it's done in a safe manner. And just because you get a vaccine doesn't mean you can't get COVID, right? You need 2 doses of a vaccine. After a week, you're 95% protected probably. So we have to think about all those things. There's a lot of moving parts here. And again, we're designing something that is sustainable, that's safe, and that reaches all Manitobans. But again, we have limiting factors there. We have to think about cold chain, significant cold chain issues. We have to think about the logistics of moving vaccine. We have to look at the number of workers required. We have to look at managing that, the flow of individuals through that facility. We have to think about the second dose. Right? So there's a lot of work that's done and is being done. We're refining that. We're learning lessons from this clinic that we ran, or the clinics that we ran, and we're going to take those lessons to make sure that the next step, the escalated, the larger immunization centers are prepared and can manage thousands of clients on a weekly basis.
From CHVN, Taylor.
Hi, good afternoon. Dr. Atwal, I know you can't give the exact numbers for Christmas yet, but with what you anecdotally saw over the weekend, are you more or less concerned about people gathering for New Year's, and why?
Yeah, again, I don't have enforcement information. I know all the individuals I know, they did what they were supposed to do. My family did essentially the same thing as well. I think there's a lot of buy-in. I think as Manitobans have always sort of worked together to facilitate the spread of COVID-19. I think Manitobans adhere to the messaging. I think a lot of people did what they needed to do. And I'm hoping the same happens over New Year's. Again, this is about having a good start to 2021. I think we're heading in the right direction, but there's still work to be done.
And these restrictions were set to be in place for a short while, but now it's been close to 2 months. How much longer can Manitobans expect to be under these strict restrictions?
Well, to be quite frank, I mean, I can't see us getting out of all of our restrictions in the near future. When we look at a vaccine program, when we look at how long that takes to vaccinate the bulk of Manitobans, it's going to be months and months. And that's what we need to look at from an immunity perspective, right? To be able to a life that was before COVID, with events, with audiences, with stadiums, with arenas, with concerts, etc. So I think there'll be, if we're heading in the right direction, obviously we want to put on the least amount of restrictions to Manitobans, and that's what we try to facilitate. And I think that's what we've done. We educate people. We obviously do orders as a last resort, and even past that is the enforcement side. So when we scale back, we're going to scale back potentially. If we do scale back, it'll be done in an organized way where we want to limit the impacts again on the acute care system, on the public health system. And again, the vaccines won't play much of a role in that early on. because you have to have a large percentage of population vaccinated to look at protection.
And when you start scaling back, maybe even bringing Manitoba to orange, what do the case numbers need to look like and for how long?
Well, I mean, it's a hard question to answer, right? It's not just about case numbers, it's about acute care system, right? So if we could have small numbers of cases, but if they're in certain populations, vulnerable populations, your hospitalizations are high, right? So again, this is looked at on a regular basis. I have no black and white answers for you right now. There's a lot of variables that come into play. And as time goes on, we'll be very transparent about our public health measures and the orders, et cetera. And time will tell.
From the Winnipeg Free Press, Katie.
Good afternoon. Dr. Atwal, some other provinces have announced projected timelines for when they expect the vaccine to be available to the general public. When do you expect to see wider access to the vaccines for all Manitobans?
Well, so I mean, the vaccine is available to all Manitobans, but it's obviously, we're focused on sort of our acute care system. It's going to take some time. We have some planned numbers, some expected numbers of delivery of vaccine from manufacturers. Perhaps there will be another vaccine that becomes available that's approved by Health Canada. I mean, that'll play a role in sort of timelines, et cetera. Realistically, I think when you're looking at those at greatest risk and our planning for right now, we're focused on those healthcare workers who are forward-facing with COVID-19. We're focused on, PCHs and personal care homes and the people living in those homes and the workers in those homes as well. And I think once we have a better understanding of the supply and clarification and verification on the assurity of that, we'll have some better answers in relation to vaccine availability for the general population.
Okay. Has there been any further wastage of the vaccine since the 7 doses that you spoke about last week?
Yeah, so, I think we need to understand wastage a little bit. Whenever there's a vaccine program, there's always going to be wastage. Most vaccine programs, when they're running, they look at 5% wastage, right? For various reasons. It's wastage because you could have dropped the vial, a vial could have been cloudy, you could have drawn up a sample and the needle head touched something that wasn't sterile. It could have been that you drawn up the sample and at the end of the day there's no one left to vaccinate. There's many reasons to have vaccine wastage, right? So from a manufacturer perspective, from a federal Health Canada perspective, we always anticipate about 5% vaccine wastage. Our vaccine wastage is less than that, obviously. I believe it's 1/10 of that on a percentage basis. And I don't think we need to focus on this. I mean, the vaccine wastage happens. It's obviously there's no intent there, but there's a multitude of reasons why this can occur. And again, I think Manitoba is way ahead of the curve on that. So there should be more focus on that, perhaps, rather than worrying about 1 or 2 samples or immunizations that went awry.
Okay, but you're keeping track of the doses that are wasted or discarded?
We are keeping track of that. I don't know if I have the number for that off the top of my head, so I apologize, but that's something we can get to you.
Okay. And I'm also wondering, this may be a question for Lanette Siragusa, but given that we just went through, obviously the first Christmas season during this pandemic, can you give us a better idea of what frontline hospital staff were faced with over the holidays, and what are the current staffing levels like in our hospitals right now?
Well, we were in a situation where had the numbers been going up and getting higher, then we probably would be in a worse situation than now. The operational teams at the sites all worked really hard together prior to the holidays and throughout the holidays to make sure that the staff was available in critical care and medicine specifically, as well as personal care homes. So the stable numbers are very helpful within the healthcare system to make sure that we can provide the level of care that's required. So it has been stable. The nurses have stepped up and been working hard, and as well as all the other support staff around them. So care has carried on, obviously, and we're in a decent space now, and we're hoping that this continues going forward.
From Global News, Brittany.
Good afternoon, Brittany from Global. Dr. Atwal, my first question is, when is the first doses of the Moderna vaccine going to be given out here in Manitoba?
Yeah, I don't have a date on that. I think we're waiting first for it to arrive, right? So again, we have plans, but that's all contingent on when supply comes, and also where we'd want to provide those doses, and that's going to come from that vaccine task force as well.
Thank you. An earlier release said that we were on track to do about 10,000 doses per week in the month of January. Are we still on track for that?
Yeah, it's going to start off a little bit less than that for next week. Again, we're going to take that next step up. So I think next week it's going to be 6,000, and then as the month progresses on, we're going to strive for higher and higher numbers, and the planning is for that for sure.
And with our numbers going down, can you tell us about the number of close contacts many people are having? We heard before up to 65 for some cases. We would be hoping that those numbers would go down as we see these restrictions in place. But do you have that average number of close contacts?
I don't have that for today. There was some numbers from last week, and I don't remember off the top of my head. So that's something we'd have to get back to you on.
From the Brandon Sun, Michelle.
Good afternoon. I'm wondering, what were the criteria for choosing the 3 personal care home locations for the rapid testing pilot? And can you explain to me why you're choosing weekly testing rather than daily testing, such as with hockey players, for example?
So the decision to pick those 3 sites, we wanted to look at it was in conversation with the personal care home operators. I think they wanted to identify a big site, which Deer Lodge would be. They wanted to identify a rural site, so Nipawa was chosen, and Donwood offered to their private personal care home and offered to be. I think they haven't had any COVID cases. So they wanted to be part of the pilot as well. So they put their hand up and we accepted. So it was that simple. And in terms of the weekly testing, I'm not sure how that was decided. Do you know?
I'd have to review back a couple of emails, but my understanding there was a limited number of the testing supplies, and we had to create a pilot project, and we had to understand again what does this program entail, what information are we going to get from it, and is it impactful? So again, it's a 3 or 4 week pilot project, and again, I think we're in our 2nd week into it now.
Yeah.
So we'll have a lot more information, I think, on the pan bio, how it fared within a long-term care facility, what impact it had or did not have, and then thereafterwards, I think we'll have to look at that information to see the utility of such a program.
But they did set target numbers, so they are meeting and in some cases exceeding those target numbers of how many staff are being tested. And part of the process is to evaluate not just the mechanics of the Abbott Pen Bio, but also if staff are choosing not to get tested because it is voluntary, not mandatory, then we can learn why they might not choose to get tested. Some don't like the whole swabbing experience, and so there might be other reasons. So we want to just learn from this. Just like everything, we take small steps before we run, and so this has been very helpful. Even in the first week, we've learned a lot about this process.
Okay, great, thanks. So what is the situation with long COVID or post-COVID syndrome, as some people are calling it, in Manitoba? One infectious disease expert has stated that it's vital that long COVID is quantified and monitored in the same way we've been doing for hospital admissions and deaths. So can you paint a picture here on what's going on in Manitoba with that?
Yes, I mean, most people who get a COVID infection, they recover well within that 10-day time period. They're definitely not infectious there afterwards. There are some individuals who have some residual effects from that. It's a virus. A lot of viral infections that we know about already can have some long-term sequelae in individuals or some long-term impacts. So, I know work is being done on this. Not just here, but I think around the world to understand what some of those impacts are. And as time goes on and more people experience symptoms or have signs or something thereof, then that information is going to be assessed and reviewed to determine exactly what were the impacts of COVID to individuals on a long-term basis and what percentage of individuals. Most people, again, do recover. This isn't the majority of individuals. This is a smaller minority of individuals where their symptomatology post 10 days and perhaps even longer than that.
Okay. And for those people that are experiencing that sort of long lag, what kind of supports are in place for them?
I think it all just depends on what the issues are, right? Is it, are they suffering from fatigue and they're just a little bit more tired, but are still able to function, still able to work, etc.? I mean, then it's more support and just kind of following them along and seeing what happens on a week-by-week to a month-by-month basis. Obviously, some people might be more impacted, and I think there are those supports out there for individuals through the government to help support individuals. I don't think there's a specific program related to this, but there are supports there for everyone in Canada.
From CJOB, Amber.
Hi. I'm wondering, with some people maybe not following the rules around Christmas time, when would we start seeing cases from Christmas gatherings? Like, when would that kind of start popping up?
Right. So, usually about a week or two after like an event, we would start to see an increase in cases. So if there's a lot of individuals who potentially were exposed or doing things that they shouldn't be doing around, December 25th or 24th or 26th, probably about 7 to 14 days afterwards, we start to see an increase in cases related to that event.
I know we've seen one adverse effect reported, at least, from the COVID vaccine. Is it still just the one, and was that a very serious adverse effect? Is there any more details you can give us about what happened there?
Yeah, so, there was one reported what's called an adverse event following immunization. So, pain at the injection site is an example of an adverse event versus something like a full anaphylactic shock. My understanding was this person did have a symptom, but it wasn't anaphylactic shock. And it was only one person that I'm aware of that's had what's called an adverse event following immunization. Just because there's an adverse event following immunization, I think we need to understand that it may not have been the immunization that caused that. Right, so there's lots of other reasons to have a symptom like pain or fatigue, or have a reaction like hives or a anaphylactic reaction, obviously. So what happens with a report like this is an investigation is done via public health individuals, including physicians, and that is reviewed to determine if it is truly an adverse event related to the vaccine. And then that information is also shared, with our counterparts, both provincially and federally, to look at a database that keeps track of that information. So there's a whole bunch of, there's a large investigation that's done with the person. There's a medical review of that, and that information is brought forth to other bodies. This is true for all other vaccines that we provide as well. So this isn't just unique to COVID. This program has been in place for many, many years. So we go through this on a regular basis. And it does takes a bit of time to go through that process. So I think in the future we'll be looking at reporting this at online, but it would be once a review is done of that case. So it will take time to get more information in relation to whether it was truly related to the vaccine or not.
Okay, and for those who have already contracted COVID, are they being offered the vaccine at this time and in the near future?
Yeah, so that's a good question. So we're kind of working our way through this on a public health side. So obviously there are some individuals who have had COVID who do qualify for the vaccine under our criteria right now. At this point, we haven't turned them away. And a bunch of different reasons for that. One is, just because you get COVID, we don't know what that long-term immunity is. We do anticipate it being for a period of time thereafter the infection. We're looking at operationalizing a program that's for the entire province. We want to try to streamline that as much as possible as well. So at this point, we haven't done that, but there is ongoing discussions and related to everything that we're doing, vaccines and testing, and every day we're looking at that information. We're looking to see what other public health partners are doing right across the country as well. And, so work is being done on that. And at this point, we have not turned them away, though.
Thank you. We have time for just a few more questions this afternoon. Please proceed.
Dr. Atwal, on Thursday, NHL Deputy Commissioner Bill Daly stated that a tentative agreement was in place with the 5 Canadian provinces to allow NHL to play in the Canadian cities this coming season. What concessions were gained from public health authorities in the letter that you folks requested of the NHL?
Yeah, I mean, we worked with our partnering provinces that are impacted by this. I don't think there was any concessions there. I think we had some recommendations for the NHL, and we provided those recommendations to them. At this point, I haven't heard on a final plan for the NHL. At this point, I haven't really heard much more.
What were those recommendations?
Yeah, I mean, at this point, I don't know if that's public right now. So I'm just not going to say anything about that right now.
Well, TSN reported a lot of the details on Thursday morning. Were they accurate?
I'm not. Who provided details Thursday morning? Sorry.
TSN reported on the details of Dr. Hinshaw's letter on Thursday morning. For example, they requested greater testing. They wanted to see more games in bunches and as opposed to as much flying around, especially early on in the season. That's accurate to your knowledge?
Yeah, so there were some recommendations made from a player's perspective. I mean, they had a good plan, and I think there was some other, we had some recommendations to help mitigate risk even further. Again, those recommendations were provided to the NHL. So at this point, I think we're just going to wait to hear back from them.
Dr. Atwal, I'm wondering if your approach to asymptomatic testing will be changing as we enter 2021 and time goes on.
Yeah, I mean, our approach, I don't think at this point is going to change. I mean, we're focused on asymptomatic testing where it has an impact. Again, we're looking at different testing tools, and we always have different strategies. So there is some asymptomatic testing that occurs, right? It's under the direction of public health. We are looking at some of the new tools like this PanBio for personal care homes, and that involves asymptomatic testing, obviously. So we are looking at that. We've obviously rolled out a pilot project. Again, nothing's off the table, but there has to be a reason for it, and there has to be an understanding what that test means and the impact of that test as well, right? So again, with each tool that we have, we'll continue to look at that.
And how much are your decisions sort of informed by other jurisdictions rather than your own, our own provinces checking it out?
Yeah, I mean, we obviously have discussions a few times a week with our partners right across different jurisdictions across Canada, including the federal government and PHAC. We like to see what everyone's doing. We look at the science of it, the merits of it, the unintended consequences as well. So obviously, I think it plays a role, but it's not that we're going to copy everything that another province does as well. We have Manitoba solutions for Manitobans, and again, we look at those tools that we have, and we try to maximize the utility out of those tools.
Thank you.
Time for one more.
Dr. Atwal, precisely how many Moderna doses are coming in that first shipment this week?
I don't have the number off the top of my head. There will be a briefing in a couple of days with media as well, so I think that number might be available by then. But again, numbers change all the time, so we like to just make sure we know what we have before we start announcing.
Thanks, everyone, and this concludes our media briefing.